What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is staying safe. If you had to take a COVID test, hopefully you tested negative. And hopefully you're not sick with one of those influenza-like illnesses that are going around. If you saw the forecast earlier today that I posted from Hubbub World and their data, there's a lot of influenza-like illness getting ready to go around. Alrighty, we have a ton of things to get through today. First off, we did get an update out of India today. Coronavirus live updates. India reports 906 new cases. The active caseload declines to 10,176. They also added 20 new deaths today as well. Now, for some of these things, we're just going to read the headlines. We're not going to fully read every story. We'd be here all day if we did that, because there's a lot of stories. This one is really bad. Long COVID has left 8-year-old a broken little boy. And we are going to read a little bit more into this one. Listen to this. This is why repeated infections is so bad. Jake was first diagnosed with COVID in August of 2021. Okay. Then in December of that same year. Okay, that's 2 times. And once again in April of 2023. 3 times this boy. And look at the picture here. This boy's not that old. He's just a child trying to have a normal life. But he can't have a normal life because 1, he now has long COVID. And 2, it's not safe. He keeps getting COVID again and again. And I mean, what's going on here? We're trying to normalize people getting infection, and this is what happens. Childhood lives are being destroyed. Adult lives are being destroyed. People of all ages are getting long COVID, and it's really bad. More on long COVID later on. We do have, I believe, at least 1, maybe 2 more things in long COVID. Like I said, there's a lot of things today. Study. Death rates in COVID ICU patients, 69% higher than the flu. There were people at the start of the pandemic, in the middle of it, and even at the point where we're at now in the pandemic saying, oh, COVID's just like the flu. Oh, and with the vaccines now and everything, it's becoming normalized. You get it, you're done and over with. No, you're not done and over with. It's still 69% higher than the flu for the number of people in the ICU. This is bad. This is really bad. Moving on to our next story. We'll just read this headline for you. Heart transplants from active COVID donors linked with higher mortality. Hello, that's not good. Moving on to this. Indiana 10-year-old gets kidney transplant after battling COVID 3 times. Not 1, not 2, 3 times. Let's read about this one. A 10-year-old Indiana girl has had a miracle come her way after she successfully received a kidney transplant. Again, I'm glad she got the kidney transplant that she needed, but repeated infections. 3 times she's had COVID. This is just unbelievable. I believe I've tweeted this story out already, or retweeted it from where I got from. You can read the full story for yourself. Moving on to our next story here. Italian book reading hit 22-year low in 2022 after COVID pickup. Gee, I wonder what could have caused that. People getting long COVID, people getting infected, and changing their mentality. Yeah, getting COVID is not fun, and it's clearly affecting everything. Moving on to our next one. Now, this is a good story. Finally, a good story. Colorado runner celebrates recovery from COVID with Colfax Marathon. 3 years ago, a COVID diagnosis almost took away one runner's chance to ever run again. This is a good story. We need good stories. This upcoming weekend, tens of thousands of runners will line up along the start line in Denver. The Colfax Marathon, the half marathon, and urban 10-miler have sold out. On Sunday, one runner will be celebrating survival. And let's read this quote. Every day I'll run a couple miles. Sometimes it's 2 miles in the morning, sometimes 1 in the afternoon. I run a little bit every day, said Kim Powell, adding a laugh. I don't run a lot, but a bit every day. How's she feeling? Let's see. Says she's feeling good. She tells herself she feels ready. And let's go back to her COVID infection. 3 years ago, back in May of 2020, Powell came down with COVID-19 in the pandemic. A nurse practitioner, Powell said she was working on the front lines of the pandemic. At the beginning of the pandemic, she was healthy, and she basically said she got this. And yeah, didn't realize that COVID did not discriminate. She got hit pretty hard. Take a look at these pictures. Looks like here she had to go on oxygen for nearly a full year. She couldn't walk across from her house. It says here she couldn't take 10 feet, let alone 100 feet. And finally she came back and she's going to be in this race. This shows how dangerous COVID is for anyone, but especially those on the front lines. Let's go on to our next story here. Long COVID-19 forces Milwaukee pastor from pulpit. So this pastor in Milwaukee is going to be stepping down from her role because of long COVID. Yet another story. And here's one for you. I posted this on the website earlier. Long COVID study reveals persistent symptoms severely impact quality of life, especially in women. That's not good. Moving on to our next thing. Now we're moving on to H5N1. More than 5,800 sea lions die of H5N1 in Chile. That is up from the previous report of 3,347. That's a pretty big increase, and that is not good. Alright, now this. Brazil is monitoring 33 people possibly exposed to H5N1 bird flu. One is experiencing mild flu symptoms and is in isolation. So basically no word if he has tested positive yet. He's already having symptoms. Let's hope he doesn't test positive, and we'll have to see what comes of this. Again, 33 people. This is one of the biggest, how can I put it? This is one of the biggest amounts of people we have seen exposed. Yet 33, that's a large number. Have they had contact with anyone? We don't know, but something like this could be what gets the whole ball game rolling. Remember at the beginning of the COVID pandemic, when there was the Princess Diamond, all those people tested positive, then they came back and kaboom, bombs away. I'm not saying that's going to happen with H5N1, but nonetheless, this is concerning to see this happen. And there is more information, and I did tweet this out. Actually, no, I did not retweet this out, and it's being retweeted right now as we speak. Alrighty, moving on to this now. Superstar Billy Graham, WWE, Worldwide Entertainment, dies at 79 years old. I don't believe that I saw a cause of death for him. Alright, moving on. We did get Walgreens this week. National positivity is at 25.4%. Moving on to this day in COVID history. May 18th of 2020, HHS awards states, territories, and local jurisdictions $11 billion in new funding to support testing for COVID-19. CDC would provide $10.25 billion to states, territories, and local jurisdictions through CDC's epidemiology and laboratory capacity for prevention and control of emerging infectious disease, ELC, and the Indian Health Service will provide $750 million to IHS, Tribble, and urban Indian health programs to expand testing capacity. Navajo Nation now has the highest COVID-19 infection rate per capita in the United States. We don't have anything to report on with wastewater for today. Our next wastewater update video will be this weekend. Taking a look here at the latest variants, which we hope to get a variant proportion update tomorrow. If you notice here, the data is now every other week. If we don't get one tomorrow, we'll have to delay the update on that till the following week. As you know, XBB.1.5 is at 64%, XBB.1.16 is at 14.3%, XBB.1.91 is at 9.2%, XBB.1.92 is at 4%, and XBB.2.3 is at 3.5%. Alright, yesterday I had some comments about Puerto Rico. Thought we would do a little investigating into Puerto Rico. Turns out, Puerto Rico COVID hospitalizations are rising. Back on April 3rd, they had 61. They are now all the way up to 133. And if we take a look at the cases chart, where's the cases chart? Here it is. They had a huge backlog of cases that they posted. And now look, ever since, it's been elevated cases. So Puerto Rico, things are starting to go south. Not good. So if you're in Puerto Rico, mask up. All right, New Jersey. 175 people in hospital, slightly up from yesterday's number, which was 173. 7 people on ventilators. ICU. 19 people in the ICU. Cases and trends. 115 cases, 125 probable cases, 2 lab-confirmed deaths, and 1 hospital death. All right, Pennsylvania. 249 people are hospitalized. Bad news about Pennsylvania. Let's scroll down here. Let's pop up my county, and that is Philadelphia County. And I do have a little sticky note here. Philadelphia COVID hospitalizations last week were at 19. What number do you see here? That's 26. That is up 7 from last week, so that's not good. And as you know, there had been elevated levels of EMS calls. The good news is, let's take a look here. The good news is EMS calls are below 700 today. This is the lowest we have seen in about 2, maybe even 3 weeks. And the reason why they were elevated, well, one big reason was post-COVID infections, and another, all these influenza-like illnesses that are going on. We're also seeing a high level of that in our area, and it did lead to an elevated number of EMS calls. All right, moving on to New York State. We got some bad news out of New York State, and that is, take a look here. Prior day test, 528 cases. Look at the positivity rate. This is the bad news. 3.5% positive in the last 24 hours. 7-day average is now up to 2%. The positivity is starting to go up, indicating New York State is starting to trend in the wrong direction. And we have been seeing this slight increase in hospitalizations. Here we go for New York City. New York City is at 199 people in the hospital. When we go to the statewide level, and we have to zoom this in to make it easier for you to see. When we go to the statewide level, it's at 562 people in the hospital, 62 people in the ICU. And let's take a look at admissions. You can see here, admissions are starting to trend in the wrong direction. They are increasing in New York State. We had the new update out of Texas yesterday. They added 43 deaths this week and 4,500 cases and probable cases. All right, we will get an influenza update out of the United States tomorrow, but not terribly concerned about that at this time of year, though. It can happen. You can get influenza at any time of the year. Let's take a look at the international COVID picture, and you can see South Korea, cases are up 13%. Deaths are down 5%. Brazil, cases up 34%. Deaths are down 9%. Canada, still trying to find out why there was a 158% increase in cases. And there's also a 138% increase in deaths. I do believe a backlog was added. Plus, it's very likely they're seeing rising cases at this point. Greece, 81% increase in cases. There, 20% decrease in deaths. We also have cases continuing to be up in the Philippines, 18%. No reported deaths this week. They just did not report them. Malaysia has 13% increase in cases, 125% increase in deaths. And then coming down here to Thailand, 39% increase in cases, 120% increase in deaths. And coming down here to Myanmar, 9% increase in cases, 2 deaths reported this week. Israel, not good. Israel cases are now up 64%. So they are seeing a big increase in cases. And they did report 9 deaths in the last 7 days. Costa Rica, 4% increase in cases and 64% decrease in deaths, 4 versus 11. So that is good to see that their deaths are down. Norway, here's a country we don't mention too often. 562% increase in cases, 576 versus 87. Alrighty, that does it for today's pandemic update video. If you see a news story that you think needs to be shared in our daily pandemic update, you can send me a direct message, you can leave a comment here, you can message me on Twitter, or whatever. You can even send an email. My email address is listed here to the channel. And send it to me. I love to see when you guys inform me of stuff that I am missing. Alrighty, thanks for watching this video. I will see you all again next time. But until I see you again next time, test negative, stay safe, hit the thumbs up button if you like this video, and if you want to see more of my content, subscribe to my channel down below. Thanks for watching, and have a great afternoon, everyone.